Greetings, everyone. Welcome to Facts Friday. We're very pleased on this episode to have joining us Dr. Jane Purvis, the president of the Ontario Rheumatology Association and a practicing rheumatologist in Peterborough, Ontario. Dr. Purvis, thanks for joining us. How are you today?
I'm doing very well. Thank you, Kelly, and thanks, ACE, for inviting me to participate.
We wanted to talk to you today about the rise of virtual care, telehealth, during the past 3 months of the pandemic. It's certainly not something new to Canada, but we certainly have seen an increase as arthritis patients, in this case, are staying at home, particularly those with autoimmune disease who have a serious risk of infection. But also medical offices and clinics are closed. Medical appointments are being canceled. Face-to-face meetings aren't happening. We therefore have this sort of ripe ground for another way to deliver healthcare. And I guess to start off, we'd like to find out your perspective, the experience of other doctors who you represent at the ORA, what the experience has been like delivering telehealth or virtual care.
Well, the first thing I'd like to say is that this has existed in the province of Ontario for some time and in several but more limited ways. And then with the pandemic onset, the government of Ontario changed the regulations around phone call visits and all video platform visits to allow us to use those tools. So we went from having only access to the Ontario telehealth network, which was something that some people have started to use, but was mostly being used for doctors who were seeing their patients in the north, or like with significant geographic disparity, to all of a sudden everybody using every method that they could. Till this day, I still haven't started seeing patients live in my office, primarily due to a lack of personal protective equipment, but also because right now I've been doing almost all my visits by a virtual meeting rather than in person. Prior to this, I had registered but had not started using the available method before called OTN. I'd signed up for it but hadn't done anything about it. And I'd also signed up for Medio but hadn't done anything about that either. And suddenly I'm using them all.
So you mentioned rural and remote communities and how we've been delivering telehealth to patients living in those areas for a while now. Maybe before we get into some specific questions, because I know you want to talk to us about a survey that the ORA has conducted, just generally speaking, what are some of the advantages and disadvantages of virtual care?
Well, in the past, the virtual care used to be offered only by going to an OTN center. So a patient and usually a local healthcare worker would meet at a hospital where this big camera sat, and then the care provider at the other end would also have to be somewhere where a camera was. So the technology was geographically challenging and very unwieldy. And though I never used that, there were times where things didn't work. But as time has gone by, the ability to access the Ontario telehealth network from handheld devices on the patient's end and from the care provider's laptop suddenly became an option, and that's made it much more user-friendly. What's often done in the far north is that an arthritis society therapist would be with the patient and they would be then meeting with a physician, let's say, in the southern part of Ontario, or even the patient would be having a distance meeting with the Arthritis Society therapist.
And that's what we've heard over the past few years from our members here at ACE. Certainly a lot of arthritis patients have mobility issues. And we've been hearing from them that the fact that they don't have to use public transport, don't have to sit and wait in the car, don't have to sit and wait in clinic too long. It's making their lives a little easier. I've just got a couple of comments that we've received from some of our members about the virtual care experience before we talk to you about some of those insights from your survey, but just from a patient perspective, patient input. One of our members said that their experience has been good. I know it's not appropriate for all visits, but I appreciate not having to travel in, being exposed to whatever I would be in the office, and just get down to it on the phone with my list of questions instead. Another patient said the call was just as thorough as an in-person appointment, with the exception of a joint exam. It was incredibly helpful. I'm not sure what I would do if I didn't have access to telehealth during this time. So those are just some of the observations from patients. Let's talk a little bit about the survey that the ORA has conducted. What are some of the, I guess, most interesting findings or learnings that you've gained through this survey, and who did you actually talk to?
Well, the survey was sent out to all of the Ontario Rheumatology Association members, but it was also sent to respirologists, endocrinologists, neurologists, allergy, immunologists, and pediatricians. Much lower percentage numbers in those groups, but they went out to some of those people as well. The interesting thing was that basically almost 100% of people were using virtual care. A lot of it done on the phone, some of it being done, maybe 40% on the Ontario Telehealth Network, and then the rest of it being done on other alternate video platforms, because it was basically left to the provider to use what platform they could get their hands on.
And what, when you asked them to rate the experience, negative to positive, what did you find out?
Basically 47% were satisfied and 25% were neither satisfied or dissatisfied. So people generally found that the providers were finding the experience positive.
And were you able to ask them how they perceived their patients' experience?
I think generally they felt that almost 100% of patients were very satisfied with having a chance to speak with their physician, whether it was through video or for phone. I think they all found it was really helpful, particularly in this extremely angst-ridden times that people are in. I think they found it very reassuring and helpful. If
a patient asked you or shared with you some concerns they had, that they felt maybe it wouldn't be as thorough as an in-person visit. One of the patient comments that I offered there was about the joint exam, for instance, or maybe it's a shorter visit. That could be a perception, but it might not be the reality.
Well, we did ask that question in our survey, and actually 80% said they were spending at least the same amount of time or more doing the virtual calls than they would have in person. And a lot of the information that you can get from patient-reported outcomes and that, as well as patients being able to look at their own joints and saying if they're swollen or not, all that information I think is still being collected and is very valuable.
That's really, really interesting. And obviously, the experience that we're having right now, these sorts of findings that you're able to collect in your survey, it's going to have an impact in the long term. That this could be, people are sort of trying to figure out, what are the legacies coming out of the pandemic in terms of the delivery of healthcare moving forward. What do you think, based on this experience, the future, where is the future of telehealth or virtual care going?
Well, I would think that there are probably two solitudes on this one, because only 40% of the patients that the physicians were caring for were actually able to access video care. And I think the further you get away from downtown Toronto, the lower the speed of the internet and the lack of access to the right equipment starts to come up. And then the phone becomes required. Certainly people who are older with either vision or hearing issues, this is something very challenging. So it, for some people, works really well. And for other people, either the technology isn't available or the skill level isn't there, or it's just not something they want to pursue. Because we still have 60% of people who are going to be just on the phone for now. But perhaps one of the things that we'll see, and I've heard the federal government talking to this, is to try and improve the access to high-speed internet. Because out of the bigger cities, that is a big need. And certainly the students have found that trying to do online school, that there are some places where the internet's just not able to handle that. But in terms of the patients who can access it, or even getting a phone call, we always say in my office in Peterborough that there's usually 2 days in the winter where we just cancel the whole day because of a snowstorm. And now what we would do is we predict that in advance, and I would, telehealth everybody, or I would phone them, and it would save them the trip. A lot of my patients are older, and some of them are traveling more than 3 hours to come. And if they're stable, and if I've seen them once in the year, let's say in the summer, I would be able to do their winter visit virtually, and I would be able to listen to any concerns. I would be able to look at their blood work with them, renew their prescriptions, send them the lab test forms. So I think we'll be able to get rid of a lot of more perilous travel based on weather, and also for people who find it hard to get out. We can also tackle some of the appointments that way.
Your survey looked at the situation as it is currently in Ontario. I'm wondering about other provinces. So is there a framework, or are there guidelines that all of the province and territories are looking at and trying to implement, or in sort of a typical Canadian healthcare fashion, is it fragmented, that there are different levels of virtual care sophistication from province to province, territory to territory?
Well, once again, healthcare would be provincial. We know that British Columbia has been doing telehealth with success for some time. Ontario has had it, but it had been in a restricted form, basically only with the OTN platform, and now other platforms are being accepted. But I think it's still in its infancy, and I can imagine that each province is probably going to come up with their own standards. Hopefully, it will be a fairly uniform standard across the whole country. I can't speak to provinces like the Atlantic provinces as to how much telehealth support they have there, but it's bound to there's bound to be more than less, I would say, given technology, given now that people have had a chance to experience it, both the patients and the treating healthcare providers. People aren't going to want to go back and say, well, I have to go and drive for 2 hours to sit in an office beside people who've got who knows what, to be told one thing. That is not something that anyone's going to want to do unless they know that there's real value in it for them now.
One of our education programs is joint health education. We spend quite a bit of time there helping people understand the nature of that consultation or that visit with their rheumatologist and how to prepare for it. I'm just wondering, for our viewers, sort of a final comment from you, Dr. Purvis, what makes a good telehealth or virtual care meeting between a patient and their physician? In this case, let's say a specialist, a rheumatologist. What are some of the things that patients should be thinking about as they prepare for that visit?
Well, the first thing that I would say, if you're going to try and do the video visit, is to give it a test run first if you can, and just make sure you understand how to sign on. Because I've already done several with people who thought they'd figured it out, but the video wouldn't work or the audio didn't work. I did one with a patient who was sideways the whole way through the thing because they weren't able to get their camera aligned properly. So there's some technical things at the beginning, but the most important parts once you get past that is just to make sure that you've got your medication list or your medications close by. And if you have any specific concerns or questions, to make sure you've got those jotted down so that you get your questions answered by the end of the visit. Having some recollection of how things have been over the last little while would be very helpful. And I think going forwards, we're going to be soon starting to email people the patient-reported outcome questionnaires in advance that you'll be able to share back even before your appointment. So for those patients who are on the more technical side of things, there's going to be a little bit of kind of pre-work that instead of doing it when you come to the office, you'll be able to do it in the days prior to your appointment and send it in.
So virtual care, I mean, from the sounds of it, the way you're describing it, it's a win-win-win. It's a win for patients, it's a win for the healthcare provider, and ultimately a win for the system, the healthcare system. It'll be interesting.
I would agree.
Sorry?
I said I would definitely agree.
Yeah, so it'll be interesting to see, as we start to reopen, as we hopefully get out of this pandemic over the next 12 to 18 months with a vaccine, what that lasting legacy will be. What have we learned, and how can we apply those lessons in the future for healthcare delivery in Canada? Dr. Purvis, we want to thank you for taking time, joining us today. We really appreciate it. We'll be looking out. Is that survey something people can access on the Ontario Rheumatology Association's website?
It's, I believe, coming soon. We haven't got it quite up yet, but it's coming soon.
Good. Well, as soon as that comes out, we'll remind all our viewers. Thanks again for joining us. And thank you, ACE members, for joining us for another episode of Facts Friday. And please visit us again next week for some new episodes on our program. Thank you.